Precision medicine in psoriasis. The rise of dual pathway inhibitors. The landscape of psoriasis treatment has undergone a radical shift. For decades, patients relied on broad immunosuppressants like methotrexate, which affected the entire immune system to manage symptoms. Today, the gold standard has moved toward biologics, highly targeted therapies that intercept the specific biological messengers responsible for skin inflammation. As these therapies evolve, a new question has emerged. Is it better to block one inflammatory signal or two? The science of inflammation. The IL-23-IL-17 axis. To understand the latest breakthroughs, one must understand the inflammatory cascade. Psoriasis is not caused by a single rogue cell, but by a chain reaction of signals known as the IL-23-IL-17 axis. In this process, the cytokine IL-23 acts as an upstream driver, signaling the body to produce more IL-17, which then triggers the rapid skin cell turnover and redness characteristic of psoriasis plaques. Most current biologics, such as Skyrizi, Cosentyx, or Humira, are designed to block a single point in this chain. They act like a single roadblock on a highway, stopping one specific type of traffic. Enter the dual inhibitor. Casting a wider net, a newer class of treatment, represented by the drug bimekizumab, Bimzelx, takes a more aggressive approach. Rather than blocking just one signal, it is a dual inhibitor, meaning it targets two distinct inflammatory pathways, IL-17A and IL-17F. While IL-17A is the most potent driver of inflammation, IL-17F is also present in high concentrations in psoriatic skin. By neutralizing both, dual inhibitors aim to achieve a more complete shutdown of the inflammatory response. Comparing clinical outcomes, data suggests that this wider net approach may yield superior results in terms of skin clearance. Higher clearance rates. In clinical trials involving over 700 adults, bimekizumab saw approximately 67% of patients achieve complete skin clearance, compared to roughly 46% for secukinumab, a single-target inhibitor. Speed and durability. Dual inhibitors may work faster to clear skin and provide longer-lasting results. Comparative efficacy. Studies have shown that bimekizumab consistently outperforms older biologics like adalimumab and ustekinumab, often by a margin of 10% to 20% in total skin clearance. Finding the right fit. It's not always newer is better, despite the impressive statistics. Medical experts caution that a dual inhibitor is not a universal silver bullet. The choice of medication is a highly individualized process involving several critical factors. Disease presentation. For patients with highly active or intensely red, inflammatory psoriasis, dual inhibitors may be the preferred choice. Side effect profile. While effective, dual inhibitors are associated with a higher risk of oral candidiasis, thrush, a common fungal infection. Practical realities. Insurance coverage, cost, and the patient's history with previous medications play a decisive role in treatment selection. It becomes less about which drug is better overall and more about which one is the right fit for that patient, says Dr. Chris Adigun, a board-certified dermatologist. Conclusion: the transition from broad immunosuppression to single-target biologics has already revolutionized psoriasis care. But the emergence of dual inhibitors represents the next frontier of precision medicine. While these newer drugs offer the potential for faster and more complete skin clearance, treatment remains a tailored decision based on a patient's specific inflammatory profile and lifestyle needs.